We need to thank the Cubans for their generosity and for their comradeship and for the fact that Cuba is stretching its hand across the globe, helping others in this time of grave need. Let us welcome these Cuban doctors with open arms and work with them and make sure that they feel at home in our country as we feel at home in Cuba whenever any one of us travels.
While we would welcome any addition to our healthcare response to this pandemic, it does beg the question whether or not the department has done due diligence in ensuring that all our own experts in the country who can be at the forefront of the fight against this pandemic are in fact utilized. We need to make sure that all our doctors, all our specialists are actually in fact part of the response team.
We should be inspired by Cuba's medical internationalism guided by socialist values, values that put lives before profit at all times. We must all be grateful for the visionary leadership of Commandant Fidel Castro, who started Cuban medical internationalism more than 60 years ago. We thank the Cuban doctors who have gone to the front line and fight coronavirus. We salute. We also want to welcome them to South Africa.
The IFP welcomes the arrival of the Cuban health practitioners who have come into the country to assist during this COVID-19 pandemic period. We believe that international cooperation is of absolute importance during this very difficult time for the world. However, we must also at the same time call upon government to make sure that South African healthcare practitioners, nurses and doctors who have found themselves unemployed in the recent past or post their graduation are also prioritized for placement wherever opportunities and vacancies will arise.
We welcome the arrival of Cuban doctors in our country, as we believe that their experience and expertise in various medical fields will assist us in the fight against coronavirus. The fact is, as South Africa, we need all the assistance we can get at this point in time. All of us can realize that the number of infections are increasing on a daily basis, and with winter approaching, one can only hope that we'll be ready with adequate infrastructure and personnel.
There are certain pertinent questions with regards to the Cuban assistance, especially related to what this is costing South Africa, and this needs to be answered. We do have a huge shortage in the primary health care, and these Cuban healthcare workers can assist in that regard. Also, South African retired nurses and doctors can be asked to assist.
Well, as an ATM, we welcome the arrival of the Cuban doctors in our country. We really appreciate what they've done for us. We know this pandemic is a global one. It's a global pandemic. Everyone is concerned about his or her country, but for them to leave whatever they were doing in Cuba and come and help us, we really appreciated that.
The ACDP welcomes the arrival of doctors and nurses from Cuba who have come to assist government to screen and to test our people for COVID-19. We need all the help we can get from anywhere in the world. But our major concern is that we have many unemployed local doctors and nurses.
This vicious enemy called coronavirus must be attacked from all sides. We welcome the presence of the Cuban doctors to come and assist us in this fight. We know that Cuba was always our friend, even during the dark days of apartheid.
And of course, some of these issues will be addressed by the health minister when he holds his press briefing. We had said earlier on that it would be 1900 hours, 7 p.m. That's being delayed by another 30 minutes. We understand that the minister currently still in engagements, but he will be hosting that press briefing with his deputy minister, including experts from the National Institute of Communicable Diseases and some provincial MECs. So that is coming at